All right. So today we're talking about marijuana or cannabis, and you're going to learn all about how it works, the pharmacology of it, and the different effects that it has on the human body. Before I begin, please subscribe to the channel, subscribe to the Brain Health with Dr. Nissen podcast if you're interested in these topics and want to. And part of that hardiness is due to the fibers that make hemp fiber such a prominent fiber for use for different fabrics. So delta-9 THC, or THC as a lot of people talk about it, is the psychoactive component of marijuana. And it's found in the highest concentrations in the flowering tops of the plant, or in the brown or black sap, which is what people refer to as the hashish or hash. So it's typically dried, ground, and rolled into joints, as a lot of people have seen depicted in film or in your personal life. And the potencies have increased over the years to where now there's more THC containing plants than before, with current plants containing up to 20% THC. So in general, compared to a lot of other drugs, marijuana is very commonly used. If you compare it to caffeine, for instance, maybe not so much, but compared to some of the other ones like methamphetamines or cocaine or crack cocaine, it's certainly very common. 43% of US adults had tried it at some point in a 2003 survey, and most of them trying it in around the high school, middle school age, usually between 12 to 17. That's about half the people, and then a little bit less than half the people having it be after the age of 18. So there's been different estimates done to try to understand whether or not it causes addiction, whether or not people can be addicted to it, and what the rate of the addiction or dependency is. And so some studies show that rate to be around 5%. Some people argue that's too low. Some people argue that that's too high. And certainly part of the confusion here is around whether this is a psychological dependence or physiological dependence for people that find it to have an anti-anxiety effect or an anxiolytic effect. It may be that there's a really strong psychological dependence on the substance, even if they are able to stop using it and not, go into shaking withdrawals like you would have from alcohol, for instance. There's, as far as the demographics, I already went over the ages. It seems like it's roughly similar based on different studies of how often it's used between different ethnic groups, and there's increased risk of continued use in males compared to females. So for the mechanism of action, there are actually cannabinoid receptors, which are G protein coupled receptors that are found in various parts of the brain, including the basal ganglia, including the cerebellum and the hippocampus. These cannabinoid receptors are actually not found very much in the brainstem of the brain, which is really where some really basic vital functions of the human body are determined in the brainstem. So things like our breathing and our ability to feed ourselves, for instance. So this is what makes a lot of other drugs so dangerous, and what makes marijuana comparatively perhaps less dangerous in certain contexts. So that's because you could become very intoxicated on something like alcohol or a benzodiazepine or an opioid, and these do have an effect on the brainstem, so they can make someone stop breathing. But for marijuana, there's at very high doses, there's a minimal effect on the heart rate and respiratory rate of a person. Interestingly, though, there is some interaction between marijuana and the brain's monoamines, so things like serotonin, dopamine, or norepinephrine. So these are some neurotransmitters that have been long understood to be involved in our moods, as well as perhaps some reaction between marijuana and GABA, which is a inhibitory neurotransmitter that sort of slows down the firing of our brains. So, as I had mentioned, the addictiveness of cannabis is still being determined. So there's a few ways to determine this. One way is through animal studies. So in animal studies, when it's administered to rodents, the rodents don't continue to administer it to themselves by pulling on levers, like is seen with something like cocaine, which is very addictive. And the dopaminergic or ventral tegmental area, which is involved in a lot of other substances of use, is not really strongly involved in marijuana. However, like I said, there's some evidence that there can be a psychological addictiveness to the substance, and an addictiveness relating to anxiety, like Ed mentioned before, and relating to sleep. So for a lot of people use marijuana because they find that it helps them to sleep better. And in fact, that can be part of the withdrawal syndrome when you would abruptly stop using marijuana, is that you can no longer fall asleep and that you feel a little more anxious around bedtime. So that's one way that there can be an addictive component of marijuana use. So the psychological effects of marijuana are felt within minutes. In general, for smoked substances, there's a pretty fast effect of the substance felt in the body, and this effect peaks around 30 minutes, and it can last for 2 to 4 hours. The action is quicker and more potent when smoked, but there can be cannabis that's consumed orally as well, like brownies or something like that you may have seen before. And those normally require a higher dose as well to have the same effect. The intoxication with cannabis, it results in a few different findings in the human body. So that includes the conjunctival blood vessels being dilated. So this is why people say, their eyes look red when they had just smoked marijuana, is because these blood vessels open. The mouth can dry out. You get more hungry, and there can be occasionally fast heart rates and low blood pressure as well at higher doses. So actually, some of these side effects have led to the use of marijuana to help with other issues. In particular, in cancer patients, there are uses of marijuana or cannabis-related products or medications to increase their hunger when they are on chemotherapies. So chemotherapy can notoriously take away somebody's hunger, and in general, the treatment and the cancer itself can lead to somebody to lose a lot of weight. And so cannabinoids or some of their related products can help with stimulating hunger, which is, what people talk about, the munchies when they're high on weed. It can be useful in some contexts, like in cancers. The long-term effects of cannabis, there are risks associated with it, and a lot of those risks are similar to those of smoking tobacco. So anytime that anything is being smoked, there are some effects that will likely occur in the lung tissue. If you're a vapor, you're using e-cigarettes, I suggest that you go and look at my video on e-cigarettes and the effects that can have on the lungs. But in general, there's carcinogenic hydrocarbons that are similar to those in tobacco that can create the same lung cancer risks. The smoking of the joint to the very end of it increases that risk more. The more carcinogenic hydrocarbons that you're taking in, the more those risks increase. There are some possible effects that are still being studied around cerebral shrinkage seizures, birth defects, low testosterone, chromosomal damage associated with cannabis, but those aren't generally that widely held yet and are still sort of being investigated. Then there's this issue around perceptual disturbances or hallucinations and or psychosis or psychotic disorders related to cannabis. There's the risk associated with marijuana intake and psychosis actually has a genetic backing to it, in that in general, there's a breakdown mechanism in the brain for breaking down a lot of the different neurotransmitters, in particular dopamine. And that in people that have a genetic predisposition to not being able to break those down as well, that marijuana worsens the effect of the brain's ability to break down the dopamine, and that's how it can predispose people to the risk of psychosis. So that's one of the risks associated with cannabis, as well as that there can be an intoxication impairing motor function. So, our coordination and our ability to drive. This can be 8 to 12 hours after the euphoric effects of marijuana wear off. And they are additive on top of the sort of disabling effects of alcohol. So drinking and smoking marijuana increases the risk of crashing or getting a DUI as well. There's impairments in memory and attention, reaction time, and there can be, and of course, there can be the cannabis-induced anxiety disorder resulting in excessive paranoia or fear, which is very common, particularly in novice or first-time users. That's actually a really common thing seen in emergency departments. So, for those that are looking to cut down or decrease their marijuana use, I would say that first of all, there will probably be benefits from decreasing or stopping marijuana use, as far as somebody's sense of motivation, as far as their sense of self-esteem, based on different things that I've read, and also personal interactions I've seen with other people. So for those that are, looking to stop, there are different resources for abstinence and for support. This can be done in an inpatient detox sort of setting, where somebody's closely monitored to help them to remain abstinent during that time. But in general, the withdrawal period is not as dangerous as it is for something like alcohol withdrawal or opioid withdrawal that can be very uncomfortable. And there can be, as part of this, supported abstinence, a lot of these programs have urine screens. It's important to know for anyone who's going to have a urine screen and uses marijuana, that marijuana lingers for a very long time in the body and can be sensed up to 4 weeks after it's consumed. So keep that in mind as well. We'll leave it at that for now about marijuana, the effects that it has on the body and how it works in the brain and in the body. And hope you found this helpful. Please subscribe and listen to the Brain Health with Dr. Nissen podcast. Have an awesome day.